you know there's a part of a human being's body called the perineum? Where is the perineum located? Stay with me, let's find out together. Juliana Ome is the name. Care of the perineum is the topic. The perineum is the area of the body that covers the lower part of the hip bone, underneath the hip bone. It is not just the part of skin, but the entire region and all the muscles that protect the bladder, the rectum, and the reproductive organs from below. Both males and females have perineum. In males, the perineum is the area between the anus and the scrotum, while in females, the perineum is between the anus and the vagina. This little space is very important. The perineum covers some muscles which help to hold the organs of the pelvis in place. You can picture the perineum as undercover for the pelvic organs, so it serves a protective function in addition to other functions like directing the head of the baby during childbirth. The final obstacle a baby will overcome during labor is the perineum, and the baby can tear the perineum because of delivery. So the kind of wound a woman may sustain during childbirth is largely dependent on how strong the muscles of the perineum are. And oftentimes women know little about the perineum and the care they ought to give to their perineum, as well as the advantages of giving an extra attention and care to the perineum in preparation for childbirth. For these reasons, I thought it wise to put few tips together in its most comprehensive form so that we can learn and be at our best while we carry out the function of childbirth. By the way, kudos to all the mothers out there. You guys are amazing. You're special. You're superheroes. Please, the information contained in this health talk is for everyone, males and females alike. If you're a man, don't skip. Just listen and learn. Knowledge knows no gender. You can teach it to your sisters, your friends, your colleagues, and everyone. Care of the perineum is the care you give to your perineum to keep it healthy and firm to perform all its functions. And this care starts with hygiene. Keep your perineum clean and dry. Anytime you use the toilet or the convenience to urinate, wipe dry before you wear your underwears. During your menstrual flow, use good pads and change your pads regularly. Give your perineum some space to breathe. Use breathable underwears. Don't wear your underwears round the clock. When you take your night bath, just wear your nightwear. But if you must use pants at night, let it be cotton pants or very light disposable pants. Of course, if you're in your menstrual flow, you must use pants at night, right? Just check my channel on the topic vaginal health for more details. The next care is exercise. We stated earlier that the perineum has muscles, right? Now, for the pelvic floor muscles, just like the exercises you do to help tone up your abdomen or your biceps or other muscles in the body, there are exercises that can help to tone up the muscles of the perineum and subsequently protect the organs of the pelvis. This exercise is known as Kegel exercise or Kegels. Kegel exercises are done by both males and females, but we shall be concentrating on the Kegels for females. Kegel exercise is like pretending like you want to urinate and then you're able to hold back the urine. That is what you want to achieve. So if you can do that for some seconds, the job is done. But these are the steps you should take to achieve this particular goal. 1, make sure your bladder is empty. If you have the urge to urinate, please do so before you start the exercise. Then sit or lie in a comfortable position. Then now try and tighten the area between your anus and the vagina. You feel it. Try and tighten it as if you're trying to stop yourself from passing gas. Then draw the muscles upwards and forward. You feel a lift and a pulling forward inside of you. Hold this tightening for a few seconds, maybe 10 seconds. You can set a timer. Then after 10 seconds, relax yourself and count another 5 seconds. Repeat this step many times in one session. And you can do it up to 10 times in a session. A session will take about 2 to 3 minutes, very short. You should repeat this session, this pulling in of your muscles, when you want to do things that put pressure on your abdomen. Maybe you want to lift a heavy object, or you want to cough. Or even after urinating, just, try and hold for some seconds, release, hold, release, while you flush the toilet and all that. Aim to perform this exercise at least 3 times over the course of your day, every day. You can have a session while brushing your teeth, while making babies food or changing babies diapers, or even while watching your favorite TV show. Just make it a habit, and before you know it, it will become a part of you. And make sure while doing this exercise, you're not holding your breath. Breathe freely while doing the exercise. Now, this is how Kegel exercises work. There's a sling of muscle extending from inside of the hip bone to the anus, and it's just like a rope tying around the vagina, the bladder opening, and the rectum. This group of muscles help indirectly to control the bladder muscles. Now, when you feel pressed and you have the urge to urinate, these muscles will relax to allow you to urinate, and they tighten up to stop the flow of the urine when you finish. This little explanation is what happens when a normal adult male wants to urinate. Now, in the course of childbirth, some women lose control to some extent, and instead of the muscle to tighten up when they are not ready to urinate, it will be a little loose. But after a while, they recover fully and they gain their control. So what Kegel exercises will do for you is to help you achieve this recovery faster and better. And also, when you do the Kegel exercises before delivery while you're pregnant, it will help to tone up your perineum muscles and you will not sustain injuries during delivery, if at all. Like I said earlier, Kegels are also done by males as well. And if you have not done Kegels before, it might be a little difficult at first. But like other exercises, with daily practice, it will become easy for you to do. So who is qualified to do Kegel exercises? Everyone, whether you're pregnant or you have delivered, you can do Kegels. There are other advantages and benefits from Kegels other than improving the perineal health for childbirth. If you do Kegel exercises during pregnancy and the muscles of perineum are firm, like we said, it will help you to overcome the stress of delivery and protect your perineum. And if after delivery you leak urine, maybe when you cough or when you strain, the Kegel exercises will help you to regain control and then to tone up the muscles and protect your bladder and the opening of the bladder so you don't leak urine. And again, some women, when they are older, they feel their uterus, their womb falling out. This is called uterine prolapse. Your doctor may recommend that you do Kegels, depending on the degree of this womb falling out. This can help you as well. And some persons experience better sexual pleasure after they begin and maintain their Kegel exercises. Yeah. Some persons may not need to do Kegel exercises, especially those persons that are probably having problems already with the muscles around their vaginal area. They are probably, they have sensations of feeling too tight and all that. You need to see your doctor for alternatives on how to care for a perineum in terms of exercise. Then the final care for a perineum is to take all symptoms seriously. If you feel pain in your perineum or rashes or discharge or you have any complaint, make sure you see a gynecologist, the doctor that takes care of women. If you found this health talk helpful, please do well to share with your friends, your colleagues, and subscribe to the channel. And of course, see you again.